Blood transfusions save lives, but big concerns a recent decision by the federal government could jeopardize the safety of the blood supply. This is Terry Lynn Langdon.
I have a bleeding disorder. I do sign for blood products every time I have a procedure, even minor procedures. I want to know that those blood products are safe.
While the blood she receives is routinely screened before transfusions, there's another safeguard, the Blood Safety or Hemovigilance Contribution Program, a national system or database which tracks adverse effects of transfusions.
There are emerging pathogens all the time, around the world, and that's what a hemovigilance system is designed to do, is to pick those up before they get into the blood system.
The program started after the blood crisis of the 80s and 90s, where people were receiving tainted blood due to rising rates of HIV/AIDS and hepatitis C.
So at that time, it was obvious that we needed a national system.
A national system that will be discontinued this March, announced by the Public Health Agency of Canada. A decision being challenged by numerous health experts, blood organizations, and patients like Langdon.
In order for the blood system in Canada to remain safe, we need PAC, the Public Health Agency of Canada, to rescind its sundowning of the program for transfusion injury and transfusion error.
If you don't have a national system to look at all the events across the country and even internationally, then you may not pick up emerging trends.
Public Health, however, says the program's end will not at all affect the safety of Canada's blood supply. Spokesperson telling us all existing mandatory reporting for unexpected and serious adverse transfusion reactions, infections, or infectious agents will continue at Health Canada. Going on to say they'll be holding discussions, including a national conference to, quote, discuss Canada's hemovigilance system and further plan for the path forward following the conclusion of the program. While Public Health doubles down, critics continue their fight. Petitions now circulating with one demand.
I'm really hoping that PAC will reverse its decision. I'm hoping that they'll include the community far more, and that we don't want this to go quietly. A lot of folks don't know about this issue, and it's very important.
As always, if you have an issue, story, or question you'd like us to look into, reach out by visiting the Speaker's Corner tab on the City News website. Taney, City News.